I could have freaking died, and my last memory would have been listening to Justin Bieber. Hello everyone, today's video is all about my story of what happened during my surgery and how I'm doing now. So I'm going to start with the little story and then I'm going to work my way up to how I'm feeling now. So I was booked in to go to the hospital. This doesn't mean to start my surgery, but I was booked to go to the hospital on November 24th and I was supposed to arrive at 7:30 in the morning. So I got there, filled out all the paperwork, everything beforehand went very smooth, filled out all the paperwork, got dressed into the theatre gown and the compression stockings on, took my earrings out, braided my hair, got everything ready, filled out all the menus, blah, blah, blah. And then it was just the waiting game. I sat around for about an hour and a half because there was, I think, 2 surgeries before mine. And the person before me, something happened, time passes, and then eventually they call me, and that is the time I separate from my mother. My mum goes back home because I was told, seeing as you're not being taken back till 10 o'clock now, you won't be put under till about 1:15. I'm not expecting you to wake up till almost like 12:30. So my mum went home. I went into the little prep room, which is off to the side of the OR. And, they were asking me all my questions. They put my name tag on. They put the cannula in my hand, which connected to a drip. And my surgeon came out and basically explained what he's doing, pros and cons, are you sure you still want to do this? And, I was like, yes, I'm sure. Just hurry up, put me under and do it. Because I was freaking out. It wasn't until that he put the drip in my hand. I think it was the pain from that too. Because that freaking hurt. The head of the needle was easily like that long. And the whole head of the needle went into my hand and freaking hurt. And normally needles and things don't actually hurt me, but that one freaking did. Anyway, they wheeled me into the OR. I got onto the table myself. They put I already had the compression stockings on, but they put the padded ones on me, which were connected to like some pump thing, and they like circulated the blood pressure around even more, or circulated my blood around even more, so I don't get clots in my legs. And as they were putting me to sleep, a Justin Bieber song came on the radio. So I went out listening to Justin Bieber. I could have freaking died, and my last memory would have been listening to Justin Bieber. I can't remember what song it was, but I know it was really annoying. Anyway, they put the oxygen mask on me, and I saw the anesthesiologist put something in through my drip. I had a really long cord on it for some reason. So I saw him connect something into it, and he goes, your gas is going to smell in a second, but within, 5 seconds you'll be out. And it really stunk. It stunk like burning plastic, but like not completely like burning plastic, but it was along those lines. It was gross. And the next thing I knew I was waking up in the recovery room. So as I said, I basically went to sleep with the cannula IV in my hand, my theatre gown on, my underpants on, and the stockings on my legs, and the cap on. I woke up, the cap was off, I had an oxygen mask on, I had the bandage underneath my nose, I had heart rate monitor on my finger, I had a blood pressure cuff on the same arm, I had the cannula in, which still had the drip in, which had 3 other things hanging from it. The nurse was always clicking something else through my drip. I think they ended up giving me like 3 shots of morphine. I woke up with hundreds, or probably not hundreds, I reckon it was more like 30 of these ECG pads all over my body. I kept one to show you. I woke up with these all over me. And the nurse was checking my temperature, and it was kind of strange. So pretend this is the thermometer. Instead of, having the one where they check it in your ear or under your tongue or even under your arm, no, this one they just hold to your head like this. Doesn't even need to touch your head, it just sits there like that. And it had a bright red light like this, and that's what I woke up. I opened my eyes and came around to this bright red light in my face. And yeah, the nurses wouldn't like, oh, I didn't say they wouldn't leave me alone, but I wasn't allowed to be alone, as in, even though I was in the recovery room and there was like 10 nurses in there all the time, one was always standing next to me. The one that I had when I first woke up had to go give something into one of the operating rooms, so she left and made another nurse take her spot. And I think my surgeon came out to see if I was awake, and I heard her call out to him, "She's very, very tacky." Now, I knew that meant tachycardic, but I didn't know it was me. There was another woman in the room, in the recovery room, but she had the curtains drawn around her. I assumed it was her, so that in case she went into cardiac arrest or something, she wasn't, like, you know, visible to everyone else. But I didn't realise it was me. And it wasn't until, you know, other people who went into their surgeries after me were coming out and they were going back to their room. Other people were being brought out, taken back to their room, and I was still in the recovery room. A surgeon came out to talk to me. I was still groggy as hell. And he goes, "Surgery went perfectly well until the end." He injected atropine into the back of my nose, which will constrict my blood vessels and stop me from bleeding. He said that totally worked. I didn't even bleed that much. But he said it raises everyone's heart rate. But I had what they call an extreme reaction to it. So your heart rate, they say, rises, you know, it could say your heart rate's 60, it could rise up to 80 to 90, something like that. Mine went up to nearly 200, probably 210, something like that. And he said for a couple of minutes there, they thought they were going to lose my heart rate, meaning they thought I was going to go into a full-on cardiac arrest. I was considered going into a cardiac arrest. One of my mum's friends is a nurse, and she said there's 4 different types. I was one of the types where my heart rate just kept escalating. And so he said my heart rate was going up, my blood pressure was going down, and for some unknown reason my temperature was going up. Which, that's what makes them think I had an allergic reaction to it, not just a normal reaction to it. Like he said, it's like fear. Everyone's heart rate rises a little bit with fear, but he said, you know, I had that extreme reaction to the atropine and it raised my heart rate. So that's why I couldn't be left alone in the recovery room. That's why I was on the oxygen for so long. They were hoping that it would lower it. And that's why I woke up with everything all over me, because they were worried my heart was going to stop. I woke up and I remember once I got my bearings, I looked to the side of me, my left, and there was a defibrillator there. I don't know if that is where they just set it normally, like if that's where it just stays all the time unless it's in use, or if they had it there for me, I'm not sure. But it was a terrifying ordeal when they're wheeling me out of the recovery room and taking me into coronary care. I was still too stupid to realise that coronary care is like, oh shit, I'm not going to the surgical ward. I'm going to cardiac care. But yeah, so instead of spending the night in the surgical ward like I should have, I spent the night in cardiac care. I didn't sleep at all because I had to leave my heart rate monitor on and the blood pressure cuff on, and the blood pressure thing, the machine automatically takes your heart rate, your blood pressure, I think it was every 45 minutes. And not only that, I had a nurse come in every 20 minutes to check me as well. The only thing that ever actually hurt was my throat. When I woke up, that was the first thing I realised. I think that's how the nurse knew I was awake. I opened my eyes and I immediately just grabbed my throat. My throat was so sore because my surgeon had to intubate me in case I stopped breathing. And I had to be intubated, and I don't think I've ever had a sore throat like that in my life. To be quite honest, I'm not even sure if I felt pain like that in my life, but then again, I had just woken up and it's sort of like, you know, that quick, sharp, oh shit, I'm in pain sort of thing. My mum came up to visit me when I had the like leading cardiac doctor specialist at the hospital I was at came to see me, and my mum was already at home like back at home after seeing me when I woke up. She came back and she said when she walked in the room, like I was still in my theatre gown, she said I was like grey and my lips were blue. I have a really excessively dopey photo of me. I'll insert it right now. But yeah, that's what I looked like. And so it was kind of scary knowing that I could have died. But I'm still here, still kicking, and 2 weeks on, I'm feeling fantastic. I had my 2 week, or wasn't really 2 week, because technically it was 2 weeks today, but I had my post-op appointment yesterday, and my surgeon looked up my nose, specialist really, looked up my nose with a little camera thing on a lead. This side, totally open, totally clear. He said I have 80% more space in this nostril. And he said that this side, there is still I could see on the camera too, looking on the screen, there's a massive like ball of a scab that's like right there roughly, maybe a little bit higher, that he tried to pull off, but he said it's adhered too much. He doesn't want to pull it in case I start bleeding again, so he said basically we just got to wait for that to either dissolve or fall out on its own. So yeah, once that happens, my nose is going to be so much more open because really it's closing off a lot of my airway on this side right now. Other than that, my nose is completely open. It hurts a lot just in the tip inside, really, like up in here today, because he fiddled with it and all that yesterday, but really I've been in basically no pain. Everyone I talk to who has had this surgery has said that it's excruciating, it's painful, it's horrible, but I've been in pretty much zero pain. I was taking painkillers for like the first week, but that wasn't even for like because I was in pain. That was because I had to keep my fever down and all that, because for some reason my temperature just kept spiking up and I was on really strong antibiotics. They had to give me liquid because it was coated, like as I swallowed it, it would coat my throat too. Sorry, I'm typing a reply. Because it would coat my throat as I was swallowing it, so therefore would reduce the risk of me getting a throat infection as well. So yeah. 2 weeks on, I'm freaking amazing. I'm hoping to do a 1 month post-op, but that's Christmas Eve, so I may actually post it later, but I'll try and film it. And then I want to do a 6 month and 1 year post-op as well. So yeah. Basically, long story short, I had basically went into cardiac arrest while I was under, spent the night in cardiac care, came home, and now I'm freaking amazing. So yeah, if you want to know any more about what I actually had done, I had a rhinoplasty, no, not the rhinoplasty, that one's like awful. I had a septoplasty and double turbinate reduction. He ended up reducing 2 sets of my turbinates instead of just 1. And yeah, I might do another video on what I had done and everything, but for now, thank you guys for watching. Thank you so much for being patient while my computer's been a pain in the ass as well. And yeah, I'll see you in my next video, which don't know when that'll be, but probably next Thursday or on Saturday if I'm being nice. But yeah, see you next time, guys. Bye.